Thanks everyone for joining me tonight to talk about knee pain. First things first, I want to go over some of my objectives for today's presentation. First up, we're going to learn about the knee joint. We're going to talk about the anatomy a little bit, how it works, how it functions in daily routines. Next, we'll talk about some of the more common injuries that we see on a daily basis in our clinic, what people come to me complaining about, what their symptoms are. And then next, we'll talk a little bit about some of the treatment options that they have available for those injuries. We'll go over my favorite personal treatments, of course, physical therapy, and some of the other more invasive treatments as well. Following that, we're going to talk about some exercises, some of my favorites in particular for different types of knee pain, and I'll kind of note which type of knee pain I think some of the exercises might work best for. But first and foremost, why are our knees so important? So healthy and strong knees are really a crucial part to any active lifestyle, and increasing knee pain can really affect your quality of life, leading you to start doing hobbies a little bit less, maybe going out of the house a little bit less. And overall, when you have pain in your knee, it can lead to a lot of different imbalances elsewhere. If you've ever had knee pain before, you might have had a limp, and at that point, you can get your back involved a little bit or your feet involved. So managing knee pain and limiting those imbalances and pain elsewhere in the body is huge. Now, prolonged knee pain is a really costly thing in the physical therapy field, and we see a lot of surgical interventions with total knee replacements or partial knee replacements, and a lot of those come with the prolonged rehabilitation. So it's really important to get on top of this and make sure that you're avoiding knee pain and keeping your legs nice and strong. So let's start out with some anatomy. Now, really common question. Everybody likes to tell me that their knees pop and make noises. That's not always a problem unless it's immediately followed by pain. But let's not get held down there. Next up, we're going to start with the bones. First and foremost, if you look at that picture on the side there, we've got the patella, and that's also called your kneecap. Now, the kneecap helps to make sure that your leg bends and straightens appropriately in the right alignment. And it helps that quadricep muscle, which is that big muscle right on the top of your thigh there. It really helps to increase the strength of that muscle by giving it a pulley to move your leg around. Now, the other two major bones of the knee joint are the femur, which is your thigh bone. That's the biggest bone in our body, and your tibia, your shin bone. Those are mainly going to be moved by your quadriceps and hamstrings muscle for the knee joint. The quadriceps is going to help to extend your knee or straighten it out, and the hamstrings is going to bend it back. Now, the gastrocnemius is another really important muscle in the knee joint, and that's that meaty muscle in the calf. And that actually extends up to attach behind the knee and really helps to get that knee fully straightened out so you can lock out and walk more comfortably with a straightened out leg. Now, the other two muscles I wanted to touch on before we move forward are the hip abductors and adductors. And the hip abductors are a really, really important muscle for overall knee alignment. And we're going to be talking about those a lot with all the injuries we go over in a little bit. The adductors also play a good role in stability, but the main focus for today, we're going to be talking about those abductors. Next, we're going to take a little closer look at the inside of the knee joint. And we have a few different groups of ligaments once we get in here. We've got your collateral ligaments. You may have heard of those, the MCL and the LCL. Those are on the inside and outside of our knee, respectively. Then we've got the cruciate ligaments, the ACL and PCL, and patellar ligaments. And those are the ones that help connect the kneecap and make sure that it's moving in the correct direction. Now, you may have heard of a meniscus before, and those are really important in our knees. They provide shock absorption, and they try to reduce the friction while our knee joint is moving. As you may assume, our knee joints get a lot of force put through them from walking, going up and down stairs, jumping, things like that. So the meniscus is a really important piece of our anatomy. And another thing I wanted to mention before we move forward is the cartilage in your knees. You've got cartilage on all of your bony surfaces, and the patella is no different. So that kneecap has a lot of cartilage back there. And as you get older and arthritis starts to set in, sometimes some of that cartilage can wear away a little bit. So I wanted to make note of that because I might be mentioning that a little bit later on in our presentation. Well, all right, let's start talking about some of the more common types of knee injuries. So Osteoarthritis, one of the most common things I see in our clinic at varying stages of the disease. Patellofemoral pain syndrome. Research shows that 40% of physical therapy knee injury patients reporting to physical therapy with a knee injury end up with a diagnosis of patellofemoral pain syndrome. It's something we see a ton of in the clinic. Next up are the ligament injuries. The four big ones are the ACL, PCL, MCL, and LCL, like we just mentioned on the previous slides. But there's plenty of other ligaments that can be injured, and they can, again, be injured on a varying level of severity. Full tears, of course, take a long time to recover, but minor sprains might not be quite as long. Next, we've got meniscus tears, which can long-term potentially lead to osteoarthritis. And also we've got tendon injuries, and we've got a wide variety of tendon injuries that we can briefly talk about in a little bit. Before we go over all the injuries in specifics, I wanted to go over some of the risk factors for knee injuries in general. As you get older, you do have a little bit of an increased risk of developing a knee injury, and that may be due to osteoarthritis or meniscus tear, or really injuries in your past. Having a knee injury does put you at a slightly greater susceptibility to have future knee problems, and overuse or repetitive movements throughout your lifetime, be it sports or occupational related activities, if you're twisting, planting, moving in one direction repetitively, that could put you at an increased risk for knee pain later in life. And then lastly, I wanted to touch on genetics. Family history of knee arthritis or knee pain in general, that's something that we really can't help. And so it's important to know if you do have a family history of knee arthritis or meniscus tears or patellofemoral pain syndrome, things like that. It's something that you should be proactive about and get started with these exercises now so that you make sure that you have strong knees to avoid some of the things that you may face later on. Last but not least, obesity. We talked about the stresses and force that go through the knee every day, and any extra weight, of course, causes a little extra stress on the joint. So being able to manage that at times can help with knee injuries. Some of the most common symptoms that people talk to me about when they come in to talk about their knee pain, of course, number one is swelling. Swelling can do a lot of different things aside from being sore. It disrupts your ability to understand where your knee joint is in space. And so sometimes it just feels a little weird or off. You may not have as good control during those instances when it has a lot of swelling. I see a lot of tenderness to the touch, and that could be around the joint itself. It could be in the muscles that move the joint, or it could be the bones themselves. Weakness or instability is another big complaint that I see. A lot of people coming in saying their knees buckle during certain activities, or that they just feel generally weaker on one side than they do on the other. And the other big things are a loss of overall range of motion or a loss of function. When people stop being able to do the things that they like to do on a regular basis, it's time to reach out for some help. So let's get into the specific knee injuries that we talked about a little earlier. First up, we've got knee osteoarthritis. And this isn't something that just happens one day. It occurs over a long period of time. And it's really a decrease in the joint space of your knee joint between that femur and the tibia. And that can lead to increased pain with movement. That can be because there's swelling in the joint. There could be bone spur development, and that's because of all the forces that we put through our knee throughout the course of our lives. A lot of times I'll hear these patients complain of stair climbing, squatting down deep. A lot of times they notice that the toilet is a little bit lower than their normal seats. So that may be the first point where they notice standing up from. Causes some knee pain, and also pain after a prolonged rest. I hear a lot of times, man, every time I sit for an hour, when I get up, it really takes me a few steps before I can get going again. Those are telltale signs of osteoarthritis. And there are other types of arthritis that can affect your knee joint, but this one is by far the most common one. We see this in 10% of men and 13% of women across the United States. As I said, it's disease that's affecting almost 1 in 4 Americans. 10% of men, 13% of women have symptomatic knee OA. And that's an important point to make. Not all knee arthritis is symptomatic. And so when we get to imaging later, I'll talk a little bit more about why that word in particular is important there. It is important to note that the incidence of knee arthritis is definitely more common in those that are aged 55 to 64 years old, and more than 50% of those who have a symptomatic knee osteoarthritis problem will end up getting a joint replacement, and that could be either partial or total knee replacement. The good news is that those surgeries have really improved over the years. We've progressed a lot with both the materials used, the techniques used to put the new knee in. And so a total knee replacement at this point in time has a lot better prognosis than it did a long time ago. All right, next up, we're going to talk about patellofemoral pain syndrome. That's pain that we typically see right around the front of the kneecap. It can be on either side, but typically right in the front is where we hear most about it, maybe behind the kneecap. It's commonly called runner's knee, although it doesn't have to be a problem that's caused by running. But it does typically cause some pain when you're loading a flexed or bent knee. Basically, this is something that we can see really good success with treating in physical therapy. And over 2/3 of the patients we see will experience no pain from just a basic exercise program. Those hip abductors are a huge deal here. And we see patellofemoral pain syndrome slightly more in women than we do in men. And that hip strength in the hip abductors is a big reason why. So meniscus injuries, these are really common as well, and they tend to hurt the most when we're going downstairs. It can lead to an increase in instability or buckling. That's definitely one of the first things that comes to my mind when I hear people say, yeah, my knee just kind of gives out from under me sometimes when I'm going up and down the stairs. My head immediately goes to, I got to test those meniscus out. They do respond well to some conservative measures, but they don't necessarily heal by themselves in all cases. And in some cases, we do need surgical intervention. There's a variety of interventions they can do. They can either take the full meniscus out, or they can try to stitch it back together, leaving the meniscus in there. However, that does take a much longer time to heal and involves a much longer rehab. It is important to note, though, that up to 75% of those with osteoarthritis have reported a known meniscus injury in their past. And so that's why it's really important, if you know that you have a meniscus injury, to stay on top of your knee strength and try to limit the amount of stress that you're allowing into the joint by dispersing it with the muscles. All right. Next up, we've got ligament injuries, and there's a big variety of ligament injuries. Ligaments, as we talked earlier, we've got various ones, some on the outside of the joint, some on the inside of the joint. And most commonly, we see injuries to these in more athletic and active populations. A lot of times it's from planting or cutting type movements, or really just kind of twisting the knee out to the side. Typically, a grade 1 or a grade 2 strain doesn't actually require surgery. It may take a little while to heal, and you may need some physical therapy to strengthen the muscles around it to limit the pain that you're experiencing. But typically, that can be handled conservatively. Now, a grade 3 sprain may require surgical intervention, and that really depends on the level of the patient's function. Not everybody absolutely needs an ACL. If you're not going to be doing running, jumping, planting, all those sort of things, there are times where it may not be necessary to undergo the surgery. However, it would be recommended to undergo rehab in order to strengthen the muscles and limit the stress put on your knee by the lack of support from that ligament. So the tendons. Tendons are typically due to overuse when we get tendon injuries, and that can affect really any of the muscle groups around the knee. I see this a lot in people who are beginning new exercise routines, people who maybe used to run a long time ago, or thought now's a good time to get back in the gym and start doing more squats and deadlifts. I need to get in better shape. And they do that without maybe proper warm up, or they think they may be a little stronger than they are to get started. And these are things that can be treated successfully with rehab. And there's a lot of other things as well, like injections or anti-inflammatories. In really severe cases, we may see surgical interventions with things such as quad tendon tears. And those also come with a bit of a prolonged rehab period. Tendonitis, though, it's one of the most common tendon problems that we see. Patellar tendonitis is a really common one, commonly referred to as jumper's knee, although again, you don't have to be a jumper to get this. It really has to do a lot with repetitive movements. The big things that we target with any sort of tendon issue is typically eccentric strengthening, and that's a slow lengthening of the muscle. So basically, if you've ever heard of a negative, or if you think of lifting your arms up and slowly lowering them down, that slow lowering is an eccentric contraction, and that's really good to improve tendon strength. Next up, research has shown really good response to heavy, slow repetitions on tendon strengthening, and that's most notably for the quad tendon in particular. A lot of other tendons around the knee that we will see problems with could be the IT band, which is similar to a tendon, but along the side of your knee. Sometimes we'll see that in runners where they'll get some bursitis or tendonitis around the IT band due to either some form issues, could be overuse, or environmental issues. Now, if you've already having some soreness in your knees, you may wonder, how do I get into these exercises if I'm already hurting? I don't want to hurt myself anymore. And there's a few guidelines that we should follow when we're getting into exercises, especially in areas where we've already got pain. And that is avoid pain. If you're doing a movement and it hurts, try to do a little bit less of that movement. So if you're squatting down to a 90-degree angle and that's causing knee pain, see if squatting to 60 degrees is a little bit easier on your knees. Allow for a proper warm-up before and after your workouts. That could include stretching or active warm-ups, like a nice, easy stationary bike ride, or after your workout to kind of cool down. It's also important to promote some tissue recovery, and you could do that with self-massage, using a massager gun. You could use a foam roller, or you can use your hands, doing it the old-fashioned way. Imaging. A big question I get is, when should I get an X-ray? When do I need an MRI to figure out what's going on with this knee pain that I have? And it's important to understand that not all pain requires imaging. And I mentioned before that symptomatic knee OA is found in 10% to 13% of men and women. And it's interesting because osteoarthritis will show up in a whole lot more people than just 23% of our population. However, it's really only those 23% who are having significant pain from it. And that may be from a host of factors, but that's why it's not always smart to jump to an image to figure out what our pain is, because we may have things in our bodies normally that on an X-ray look abnormal, but they're not causing our pain. So it's important at first to maybe observe some of the pain that you're having during functional activities and use that along with imaging to help guide your treatment decisions. Now, if you're having a significant loss of function, extreme pain, swelling, instability, or there's a failure of any of these conservative measures, then by all means, an image is definitely going to help us narrow some things down and identify some structures that might be the cause. And some of the things we may use for that would be an X-ray to identify any bone issues, an MRI to look at some of the soft tissues, especially those ligaments on the inside of the knee, or an ultrasound. Ultrasound is good for the superficial tissues right at the top of the skin there, and could also be helpful when giving an injection, so that the doctors make sure that they're getting it right in the correct spot. And our arthroscopy would be the most invasive imaging that we could do, and the surgeon would put a port camera into a hole in your knee, basically to see if he could visualize any injured tissue, and then perform a surgery to help repair that tissue. But next, let's talk about some of the treatment options that you got available to you. First and foremost, we're going to talk about physical therapy, my favorite. So physical therapy evaluation can tell us a lot. If you've ever been to physical therapy before, we're going to kind of run over what a basic eval would be. First things first, we talk about what happened. When does your knee pain started? When does it bother you most? And then we'll see how well you're moving your knee and talk about some of the special tests that we can do to maybe identify some of the structures causing your pain, which can at times be almost as accurate as some of the imaging we get. After that, we'll go through some rehabilitative exercises to teach you how to, in as little pain as possible way, get those muscles active and moving again to regain some of the function that you're missing. And then maybe we use a combination of manual therapy or electrical stimulation to help with some of the pain management or soft tissue tightness that you're experiencing. And then electric stimulation could also double down as a strengthening tool. And we could use that with neuromuscular electrical stimulation to activate your quadricep muscle to really increase the efficiency of whatever quad contraction you're able to get given the state of your injury. And finally, blood flow restriction, dry needling. There's a few other modalities that physical therapists can use to kind of maybe treat more efficiently with limited movement and limited pain, especially with blood flow restriction. You can put cuffs around your legs and then perform exercises while there's increased blood flow in your lower extremities, and that can help to gain increased strength despite doing some easier exercises. Dry needling has had some promising results in the research as far as tendon injuries are concerned, but that's not necessarily available in every state. So you'll have to check with your local physical therapy office to see if that's something offered near you. Next up, some of the more invasive treatment options. So corticosteroid injections. Those are really common. They help to address the pain and inflammation in the knee joint. We'll see those with any number of the injuries that we talked about before: osteoarthritis, ligament injuries, meniscus injuries. They're not always effective, and so sometimes it may take one or two of those, but typically we recommend that there's no more than 3 of those in a year due to the systemic effects that they can have. Next up, hyaluronic acid. That's something that is similar to the joint fluid inside your knee. And there's mixed results as far as the research is concerned. It may offer some pain relief in some patients. The idea behind it is to help lubricate the joint a little more, maybe provide a little bit more space in the joint for those dealing with osteoarthritis. In a lot of my experiences, it can reduce pain, but ultimately it's not necessarily doing anything to heal osteoarthritis. So it may not necessarily avoid a knee surgery for you in your future. Platelet-rich plasma is another really good treatment option on the market. Unfortunately, it's not really covered by many insurances at this point in time. It is relatively new, but the research does show a lot of really promising results for almost every injury that we talked about so far. So hopefully in the next few years, that starts to become a little bit more accessible for people. Next up, we already talked a few times about surgical intervention. Definitely not the first thing we want to jump to if we can avoid it, but in some cases, we need someone to go in there and increase the stability of the structures and find out what happened before we can get to rehabbing it. And last but not least, acupuncture has shown some benefits in terms of pain relief with knee pain in general. Next up, we're going to talk about, We're going to talk about some of the exercises that I would use when we're addressing all of those injuries that we were just talking about. First up would be aerobic activity. Now, there's various types of exercises that can be considered aerobic. And really all that means is maintaining your heart rate up at a consistent level, doing a rhythmic set of movements. And that really helps your body in a ton of different ways. It increases your circulation. It has a really good systemic effect. If we're using the appropriate equipment, like maybe a bike, running, anything like that, it could help increase the strength or range of motion of your knee. However, there are some exercises that are better than others at limiting stress on the knee. And that's not to say that they're bad to do. It's to say that Maybe if you're experiencing pain currently and you want to get back to something like using the stair climber, going on difficult hikes, maybe we have to start by training on the treadmill, elliptical trainer, getting a little bit stronger until our knees are strong enough to accept the stress put on them by running or hiking or things like that. We've already talked about a few different examples of aerobic exercise, but some other ones would include dancing, stair climbing. You can ride a bike. Using the row machine at the gym could be a good way to help get some knee flexion in as you bend your knees and straighten them out and kick back and forth. And even using a recumbent bike or a stationary bike to just kind of stretch your knee out if you're feeling a lot of tightness or swelling in there. While it might not be an aerobic activity, that sort of flexibility exercise can be really good and very useful. The next things that I would use as I'm treating somebody with knee pain would be open chain or isometric exercises. Now, these are relatively easy exercises, and they do a good job of isolating specific muscles. Isometric exercise is one where you're not actually moving the joint, but you're squeezing a muscle. We'll go over some examples and pictures on the next slide, but an open chain exercise is one where you're moving a joint that's end point is not fixed. So if you're sitting in a chair kicking your knee up, that's open chain, rather than squatting with your feet on the ground. That's a different type of exercise. Now, these are a great way for starting to get back into an active lifestyle. If you're someone who hasn't been exercising a lot and you're experiencing knee pain and you want to start getting into a good exercise program, this is the area where I would be starting. It'll help to limit the amount of movement you're doing while still getting the muscles activated and starting to get a little bit stronger. There is also some good research out there that shows isometric exercises can help to reduce pain, especially in those with osteoarthritis. And that's a very basic exercise that you could do sitting at home watching TV at night in bed. It's something that's very easy that if done regularly on a daily basis could help to reduce your pain over a longer period of time. Here's some of those examples that we were talking about. If you look all the way over to the left of your screen, you'll see that there's a woman pushing the back of her knee down into a towel there. And she's going to be squeezing that quadriceps muscle right on top of her knee there. And that's a really good exercise, super important post-operatively. We see ACL patients, knee replacement patients, quad tendon repairs. All of these patients, we're going to get started with quad sets because it limits the amount of movement in the knee, but it makes sure that we're allowing that quadricep to get some strength back. Next up, we see some straight leg raises, a really popular exercise in physical therapy. The one on top there is a regular flexion-based straight leg raise, which is going to really target that quadricep muscle. Very good for, again, getting back into an active lifestyle. And then down on the bottom one, you'll see the hip abductors in action there. That side-lying leg raise is a very good exercise to target those hip abductors, which are going to be really important when we're dealing with things like a meniscus injury, patellofemoral pain syndrome, balance issues due to instability in our knee. That's a really good exercise to target those hip abductors, which helps to increase our strength while we're balancing on our legs. And finally, if you look over to the side there, that one's doing a hamstring curl there. That's another great exercise and an example of an open chain exercise where you're bending your knee back. Now, all of these exercises could be done in a variety of ways to make them a little bit easier or a little bit harder. Of course, we could add weight to them. We could slow down the repetitions, maybe counting out our seconds on the way up or counting out our seconds on the way down. That would be an eccentric contraction, like we mentioned earlier. Regardless, if these exercises start to get easy, then it's time that we progress on to some of the more difficult stuff. And we'll talk about that next. Closed chain exercises. So we talked about exercises where your foot's not planted on the ground. Closed chain exercises are exercises where your feet are on the ground. And they engage multiple muscles and joints, which can promote a better overall stability. They help to distribute the forces more evenly throughout the joints compared to certain open chain exercises. And sometimes open chain exercises can cause some pain that we can maybe avoid with some of the closed chain things. Now, the caveat with closed chain exercises is that a lot of times they require extra coordination or balance, and the form can be a little bit more difficult to learn. But That on the flip side of that, that can enhance our proprioception, which is our body's understanding of how it moves in space and where it's positioned. Now, another real benefit of closed chain exercises is that most of the time they mimic real life movements, which could lead to improved overall function and reduced pain during daily tasks. And it makes it a lot easier to do exercises regularly, especially if they're not the most fun, if you can understand why you're doing them and what they're benefiting. So let's go over some closed chain exercises next. Here we got the classic step up. Now we can change this again in a variety of ways to target different areas or to make it more or less difficult. We can increase that step height, and that's going to really make us feel it in the quadriceps for that classic straightforward step up. Or maybe we could slowly lower ourselves down, another eccentric contraction, really good for targeting that quadriceps tendon in the front, as well as that muscle on top there. And if you look on the side there, you'll see that she's stepping up to the side, and that's another one where we're targeting the hip abductors. When we're doing closed chain exercises for your knee, and especially ones that target the hip abductors, I'm going to be really specific about the position of your knee as you're going through this exercise. And I really want to make sure that your knee is not diving down and in and kind of not buckling, but pointing down to the inside. We want to maintain that knee in a nice straight pattern that avoids some of the extra stress placed on ligaments and tendons. And to do that, we need some increased hip strength. Some other ideas for closed chain exercise would be squats and the variations of squats that come with it. A great way to start getting back into squatting would be a wall sit. This is a way to not move the joint a ton of times, but still you're activating all those muscles that get activated in the squat, the glutes, the quads, a little bit in the hamstrings. I would challenge you to try and hold it for at least 10 to 15 seconds, move it on up to a minute if you can. And that is a really great way for getting a sustained contraction in those muscles. Once you're able to move up to more difficult things and are able to coordinate a more form, then we can move into a regular body weight squat. Or if you look over on the right side of your screen, you'll see he's got a band tied behind his knees. Those are called Spanish squats, and those are a really good way to target the quadriceps in particular. They're definitely hard, and I would recommend going down to a 90-degree angle and then pulsing that back and forth to make sure that you're getting some of the more quick twitch fibers in the quadriceps, because there's both fast and slow twitch involved there. And if you look down towards the bottom right, we'll see a single leg squat. Now, that is a really difficult exercise, but incredibly good at exercising the stability muscles and making sure that everything is coordinated between your hips, knees, ankles, really the whole bottom chain. They're great for increasing proprioception. And if they're really hard at first, maybe we could put a chair behind you and stack some books up on it so that you're only going down a little bit and you're able to get back up. Or maybe we put you in front of a chair or some TRX bands so that you can assist yourself as you slowly lower down, because the activation of the amount of muscles in your lower extremity is definitely highest in the single leg squat. Next up, we'll talk about lunges. A lunge is a great way to pick something up from the ground, but it can be a really difficult exercise on your knees. And if you're experiencing a lot of anterior knee pain in the front of your knee, when you're doing a lunge, I would challenge you to maybe try to put your weight a little bit further back towards the heel, especially on that front foot. And if it hurts more at the bottom than it does when you start the movement, then let's start by modifying the range. Any of these exercises that start out looking really difficult can always be made a lot easier if we just start with maybe the first 25 to 30% of that movement. And as you get better and notice that it's not increasing your knee pain as you go, it's important to start challenging yourself to go a little bit deeper, or try doing a few more reps, or maybe a little bit more slowly. Now, of course, I had to put one in there for hip abductors too. And if you look to the right side of the screen, a side lunge is a good way to activate the hip abductors as well as the adductors, ones that we haven't talked as much about so far. Again, those are super important, most notably with patellofemoral pain syndrome. All right, The next class of exercises I want to talk about are balance exercises. Now, I've been talking about these muscles all night, but the hip abductor muscles are going to get activated when you're balancing on one leg. And making sure those muscles are really strong can help avoid that stress at the knee, especially that stress of that down and in valgus knee stress is what we call it. And the balance training can also help to improve your ankle strength and overall lower extremity coordination, which in the long run can help prevent falls. And another thing we can get out of balance training is improved jump form and landing, as well as improved running form. Some examples of single leg exercises, of course, you could always just balance on one leg. To make that a little bit more difficult, I'd recommend maybe kicking your leg out forward, making a figure 8 pattern, maybe kicking it forward, sideways, or backwards. All of these things just to sort of displace your center of gravity, which allows those smaller stability muscles that we might not be activating with our open chain or isometric exercises. They're going to get called into play on things like this. As you start to get a little bit better at your single leg balancing, then maybe it's time to step up into that single leg squat we talked about on the last side, or here we've got a great single leg deadlift. That's another really good exercise targeting your adductors on the inside, your abductors on the outside, and of course the hamstring muscles behind the leg. Another great option. Regardless of what you're doing for exercise, the recommendations at this point for physical activity from the American College of Sports Medicine are all healthy adults aged 18 to 65 years old should participate in moderate intensity aerobic physical activity for a minimum of 30 minutes, 5 days a week, or vigorous intensity aerobic activity for a minimum of 20 minutes, 3 days per week. In addition to this, you should be strength training all major muscle groups, and that should be done at least twice a week. So if we take a look at back through those slides that we just talked about, they'll give you some great examples for meeting all of these physical activity recommendations that the American College of Sports Medicine set forth for us. Now, one of the most common questions I get about knee pain or common patients with knee pain are runners. And I want to dispel the rumor that running isn't necessarily bad for knees. It's not bad for knees. However, if you've already got knee pain and you're not a runner, then it might not be the best time to get started running. Running can be great for a strong, healthy knee when done correctly. But if you're already having knee pain, you may be doing compensations during your gait cycle, and so might not be the best time to start running again. It's really important that you're doing a proper warm-up and using the right form as you're running. That'll help to limit the stress on your knees and other parts of your lower extremity. And proper footwear is another huge concern. If your shoes are about 2 years old and you're still running 5 to 10 miles every few days, it might be time to think about a new pair of shoes. You'd be amazed at how much stress a new pair of shoes can take, a new pair of running shoes can take off of your knees while you're going for a run. And it's important, if you do want to get back into running with knee pain, make sure that you've strengthened yourself up. And as you start getting back into running, don't just go for a 20-minute run. Don't just run for however long you feel like you're able to run. Gradually increase your time and your distance to help limit your risk. And make sure you're taking walking breaks in between just to make sure you're keeping in tune with your body to see if there's any increases in knee pain as you've been running. All right, just a few last things that I wanted to go over before we end up here tonight and start talking about some questions. But some of the things that we might want to be a little bit cautious with as you experience, if you're already experiencing knee pain, are the high impact activities like running or jumping, doing deep squats or deep lunge exercises, heavy weightlifting, putting a ton of weight on a squat bar, a ton of weight on that leg extension exercise where you kick your knees out straight. Those are exercises that can be a little bit risky. That's not to say at all that they're bad for your knees. That's just to say that we need to make sure that we're putting ourselves in the best position to be trained to make sure that we're doing these movements appropriately. How can physical therapy help? Well, I think we talked about a few different ways, but it's really, I think, the best way to address any sort of knee pain initially. The physical examination the exercise rehab, manual therapy, along with some of the tools that we have to help eliminate pain, are a really great first step if you're experiencing any knee pain. Feel free to reach out to any physical therapist in your area. We've got locations all across the country. There's a few of the brand names there.